Dr. Lisa Palmer, Dr. Mama Bear, coming to you live from Central Florida on ears, Eustachian tube, and enthusiasm. Ears, oh my goodness. As a holistic practitioner, we have seen a lot of people with ear pain, ear clogging, ear discomfort, feeling imbalanced, feeling dizzy. And so you guys can pop in the chat if you have an ear that's clogged, if you have both ears are clogged, and if that's occurred recently. And so this past weekend, I had the pleasure of teaching a group of practitioners from all over the United States, natural health care in the form of quantum nutrition testing. And we found patterns with people having clogged ears, uh, imbalances in the ears, and that kind of thing. Now, you have your eustachian tube. So your eustachian tube comes down and drains into the neck. And if the eustachian tube is blocked at all, if that eustachian tube is inflamed at all, you guys can touch behind your earlobe and kind of drag your finger down your neck. If that's sore at all, it could be a couple things. It could be you have nodes in your neck on both sides called lymph nodes. And lymph nodes are part of your lymphatic system. They clean up junk in the system. They're kind of like your maid of your system. And so they're going to get inflamed when you're exposed to toxins. Where do toxins come from? Toxins are chemicals in the air we breathe. So if there's things in the air that you're getting exposed to, a great example is maybe you're walking outside and a diesel truck goes by and you inhale the diesel fumes. That's a toxin, right? You go to a restaurant and they clean the restrooms and they clean the restrooms with bleach, and you inhale that and you get a headache. Bleach is a toxin. So yes, it could be a helpful chemical. When they put chlorine in our water supply, that is a good thing to kill harmful bacteria, because you can die from drinking harmful bacteria. But the bleach that is non-diluted, if you inhale that, that's a toxin. Anything that you put on your skin is a toxin, right? So there are some ladies that are using different types of makeup, different lipsticks that have toxins in them. Anything that is a long stay lipstick, so it's like a wear all day, may have lead in there. And that lead can be added to get the lip color to stay. Most lip colors are made out of metals. And if those metals are toxins, like mercury or aluminum or arsenic, that is a toxin. There's toxins in the food that we eat, right? So food, unfortunately, can be sprayed with Roundup. Roundup is an herbicide. Roundup is an antibiotic. Then Roundup sprayed on crops is a toxin, and it gets into our food supply. Even if you're buying organic, organic does not mean no chemicals. I had a patient who is an organic fertilizer consultant, and the organic fertilizer still has chemicals, right? It still is chemicals. Organic just means less chemicals. And so toxins in the air we breathe, toxins in the water we drink, toxins in the food we eat, toxins in our environment, everything from the paint on the wall to off-gassing of furniture, to putting those scented things in the electrical outlets for scent. All of that is toxins. And so when patients tell me they've never done a detox before, I know that they're toxic. And they're like, well, how do you know that I'm toxic? I'm like, okay, well, I know that you're toxic due to the air you breathe, the water you drink, the food that you eat, all has toxins. Everything in society has toxins, and toxins are what opens the door to pathogens, to bugs, to parasites, to bacteria. It suppresses the immune system. And so people that are getting clogged ears, it could be from increased toxin exposure. That eustachian tube gets irritated, it gets inflamed, and now that ear can't drain properly. You try to swallow and get the ear to pop, or Valsalva maneuver where you increase pressure in the nose to get the ear to pop, and it's just not clearing. And so what do we do with stuff like that? With quantum nutrition testing, we assess what's working well in the system, what's not working well in the system. What is this person's toxin exposure? One of the most toxic patients I had ever worked on was a hairstylist. And she was toxic because she was applying dye to the people's hair, right? And what is dye? So if someone's getting wants to be blonde, then they're putting a bleaching agent to strip the color and then apply the color. And the colors have chemicals and the colors have heavy metals. And so inhaling those chemicals in her job led to toxicity. Touching the chemicals in the hair led to toxicity. And then a lot of hair salons also will have people that do nails. And so nail polish, ladies, it looks cool, right? But it's a toxin. You're painting. It's with paint. Painting is a toxin, and I know that's not very popular. But this one patient in particular had high levels of toxins, and she didn't feel good. She had low energy. She had headaches. She had migraines. She had symptomatic menstrual cycles, bloating, cramping, heavy periods. She just had a really hard time. And so we looked to what we could do to decrease the toxicities in her environment. Now, she wasn't going to stop being a hairstylist. I'm like, well, hey, you could do like work with organic hair color, which guys, organic hair color. I used to highlight my hair. I don't do that anymore. I used to look for organic hair color, and unfortunately, I haven't found an organic hair color. The only thing that I have found is henna. And so henna comes from a plant, and that would be organic. But all other hair colors, even if they say that they're organic, still have chemicals as part of it. So I could get her in her environment to drink better quality water, eat better quality food, but she wasn't willing to give up being a hairstylist, which I totally understand. And she wasn't willing to stop the chemicals. And then herself, she dyed her hair like really bright red. And the red color also has high chemicals and high metals. And so what happened is on our program, her health improved, and then she plateaued, and we kind of got stuck. And she kept testing for chemical toxicity, and in particular, red dye. And every time she would test for red dye, I'm like, you're testing for red dye. And she's like, red is my signature color, and I'm never going to stop dyeing my hair red. And I said, okay, well, your signature color is blocking your pathway to health. And if that is where we end, then that is where we end. And she chose to go her way. I chose to work with other patients that wanted to continue on that pathway, and say la vie, right? But it can cause the body to have a high toxic load, which leads to nasty symptoms. And that's how it goes. So I'm not having you guys, I don't expect perfection. I don't, some people are like, well, okay, well, I can drink distilled water, and I can get air purifiers, and I can clean the house with non-harmful chemicals, and I can eat organic, and I can lessen my toxin load. And to those people, I say that's awesome. But maybe that's not really realistic to you, in that you want to make all those changes. Maybe your health would improve if you just stop spraying chemicals in your yard, or you stop spraying your house for bugs, or you just looked at what can you do to decrease your toxic load, which would be less toxins in your system. Whether it's toxic load filtered by your liver is a very big filter. And so signs of toxicity in a liver is allergies, right? So the person is congested, the person reacts to pollen, the person reacts to cats and dogs, the person sneezes a lot, the person may have itchy skin, the person may have rashes, the person may have acne, they may have imbalanced hormones. Why? Because all of those toxins and even the hormones are processed in the liver. And when the liver gets too toxic, it can no longer filter that, and you're going to express more symptoms. And so we can help you with a liver detox at my practice, Palmer Natural Health, located here in Central Florida. We can help you whether you're a Central Floridian, or we can help you via telehealth locate what is the next step for you to take on your healthcare journey. We can educate you on that. We can select the products that make the most sense for your physiology. We'll hold your hand and guide you through this process. And then with enthusiasm, it's so exciting to see what are the positive changes. We see everything from one of my students actually was saying today, he said his patient said, and I quote, I feel, let's see, She's the best week she's ever had in her whole entire life. And he described it as astounding, right? So what we want to do is we want to help you with your healthcare challenge. Now, I'm not going to say that it's easy. I'm not going to say that it's, I don't have a magic wand. I know I'm in Central Florida and Universal Studios is here and Harry Potter World is here and they do sell wands, right? This is not a wand. This is a pen. I don't have a magic wand to magic away. I don't have that skill set either to magic away symptoms, right? But I am very good, and my team is very good at getting the information from you and actually listening to you, maybe for the first time in your life. What is happening? What happens when you have your period? What happens when you work for 8 hours? What happens when you try to exercise? What happens when you eat certain foods? Grabbing that data, digging deeper than probably any other healthcare professional has ever dug, using quantum nutrition testing technology to determine, where do we start? Do we start with a chemical detox? Do we start with opening the drainage pathways? Do we need to get you pooping? Most Americans maybe poop 1 to 2 times a week. That is not healthy. You should be pooping every day. And it's the quality of the poop, right? It shouldn't be little pebbles. It should be a brown banana. And not to be graphic, just to be real. So maybe we just need to get you eliminating better. Maybe there's certain foods in your diet that are triggering you to feel horrible. So back in the day as an athlete, I thought I could eat whatever I wanted. I thought the definition of health was, how good did your body look on the outside? Did you, were you fit? Did you have lean muscle mass? Were you of good weight? What did you look like, right? And I think a lot of people, especially in the United States and all over the world, have that same definition, like, oh, there's Bob and Bob runs every morning and he has 6-pack abs. Bob must be really healthy. And then Bob goes for a run and keels over with a heart attack. Bob wasn't healthy, right? Bob's body looked fit, but Bob on the inside wasn't fit, right? He most likely wasn't handling toxic load. He most likely had never done any parasite work. He most likely did not work on his microbiome. He most likely didn't balance out his organs and glands. He most likely didn't decrease his toxic load. He most likely wasn't aware of environmental toxins. And so at Palmer Natural Health, we look at these things, and together as a team, we decide together, where should we start? And what are you willing to do? And what are you not willing to do? And we help you with lifestyle changes. We give you a program that's personalized for you, not a protocol, a personalized health program. And then what's really, really cool is that we coach you, we educate you, we encourage you to make changes and to improve your health. Because when you have improved health, you can then fulfill your mission in life. You can then fulfill your purpose. You can be the best mom in the world. You could be the best grandma in the world. You could be the best dad in the world. You could be the best student in the world, the best athlete in the world. And I mean that by, we get to see truly who you are at 100%. Never have I ever had a patient come in with a migraine functioning at 100%. That can't happen, right? Migraine and 100% function is not there. And so typically someone who is not very healthy, they could be irritable, right? They could be grouchy. They can be impatient with their children. They could be short fused with their husband. They could be kind of not a nice person to be around. And it doesn't mean that's who they are as a personality. It doesn't mean who they are as a human. That's just their physiology dictating that they get hangry, right? So you should be able to fast. And if you get grumpy, when you don't eat, you most likely have a backed up liver, and we can help you with that. You most likely are not regulating your blood sugar as well, and we can help you with that. You're most likely, your family knows that you better feed mama or she's cranky and not fun to be around. And so life does not need to be like that. If you need our help, reach out to Palmer Natural Health. Feel free to direct message me here on Facebook, follow us on social, and let my office know that you saw me, that you're interested in improving your health, and we are here to help you every step of the way. I'm Dr. Lisa Palmer, Dr. Mama Bear. Good night, everyone.